We are done with the first trimesters in pregnancy. Now let's talk about the second trimester in pregnancy. One of the signs and symptoms, one of the things that actually dealt with me in second trimester was bleeding. Where was I actually bleeding from in second trimester? Do you want to know? Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today, we're going to be talking about the signs and symptoms of the second trimester. What takes place in the second trimester, what I personally experienced in the second trimester, and what you should do. But before I go into details into this class, if you are new on our YouTube channel, please click on the subscribe button, turn on the notification button so you don't miss out. For all our returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be discussing about the second trimester. Can you tell me the duration of the second trimester? How long? How many weeks to which weeks does the second trimester last? So let me tell you. But before I tell you, you can pause the video and drop your answer in the comment section. Yes, okay, now you're back. In terms of the second trimester lasts between 13 to 27 weeks of your pregnancy. It lasts between what? 13 to 27 weeks of your pregnancy. During the second trimester, some changes take place. For some people, they will start noticing their belly is getting bigger. But mine didn't really get bigger. I didn't even notice, like, my stomach was not really getting bigger till the close to the end of the second trimester. That was when my stomach became visible, gradually was becoming visible that I was actually pregnant. So to some people, they experience this big bump, and also their energy level goes up. There's increased energy level, and also for those that lost their sexual drive, the sexual drive might return during this period. And also those that were experiencing increased urination, they were going to the toilet every time to pee, there might be decreased frequency in urination during the second trimester, because the second trimester is a different ballgame entirely. But specifically, Miss Mary, what I experienced in my second trimester was bleeding in my nose. Yeah, bleeding. I was bleeding from my nose. Almost every morning I wake up, getting ready for work, I was bleeding from my nose. Yes, that was what I really experienced. That was what dealt with me in my second trimester. I was bleeding from my nose. I had to contact my GP, contacted my doctor about it. So I was made to understand that during the second trimester, there's increased blood flow as a result of the hormonal pregnancy. And as a result of that, the mucus membrane in the nose can swell, and that can result in the stiffness and bleeding you experience in the second trimester in pregnancy. So during that period, all you have to do is to press this part of the nose to help stop the bleeding. You don't have to use force to start blowing like you're using force to blow it out. No, try and see if you can constrict the blood vessels around that area. That is going to help a lot during that period. Then also stay hydrated. So let's go back and talk generally about the signs and symptoms of the second trimester. Like I earlier said, the first one I had was bleeding from my nose every morning. The second one is that appetite will start returning to normal. First trimester, personally, I was having aversion. I could not really eat a lot. But in the second trimester, you see yourself, you want to eat the chicken, you could not eat the turkey, you could not eat the fish, you could not eat the egg, you could not eat. In the second trimester, you can start eating it normally. For me, in the second trimester, brushing was still difficult to me because I still have this vomiting. But some people in second trimester, it will reduce. But me, I still had this nausea and vomiting that reduced close to the end of the third trimester. So like I earlier said, the energy level increased. You have a lot of energy in your second trimester compared to your first trimester. So most times it is advisable close to the end of the trimester, you get things that you really want to get done, like shopping for your baby things, like doing some final projects, doing all the things you have to do, because the second trimester you have increased energy compared to the first trimester. And close to the end of the second trimester, as a pregnant woman, you start experiencing Braxton Hicks contraction. Braxton Hicks contraction. These are forced contractions that are preparing you for labor. These are forced contractions that are preparing you for the D-Day of what is going to happen. So you start experiencing this tightening of your abdomen that most times when you move, when you change position, it releases you. That is Braxton Hicks contraction. So don't feel you are about going into labor. No. As far when you move, you change position, this contraction goes back to normal. It is nothing for you to be worried about. So that is Braxton Hicks contraction. Then some people, they start experiencing skin changes. I think my skin personally changed immediately I was pregnant because I started having big pimples all over. My face became very oily. My nose became swollen. My nose became swollen in the third trimester, particularly. I think so, yeah. But it was swollen in the second trimester, but the little. But to some people, they experience serious face changes. Some people have some black patches on their face. But personally, I was having a lot of pimples on my face during the second trimester. I had nasal problems during the second trimester. So these are the signs and symptoms most ladies experience during the second trimester. And also vaginal discharges increases. Vaginal discharge increases. So you know, when the vaginal discharge increases, that might show you a sign that, oh, you are good to have sex. Your sexual urge has increased also. It might, I'm not saying it's a sign that your sexual urge has increased, but most ladies experience increased sexual urge during their second trimester when compared to the first trimester, where they are tired, they don't know what to do, and they are confused. Then also during the second trimester, you are prone to UTI, urinary tract infection. So you just have to be extremely careful in regards to UTI. You have to be extremely careful in regards to your vaginal. You have to be careful to avoid this infection from coming into play, because we have a lot of ladies coming with vaginal itching during the second trimester. So you have to give some antifungal, especially if it's as a result of some thrush infection or fungal infection. But take note of urinary tract infection. Be more careful when you pee, be more careful when you poo, to avoid the spread of this infection, or to avoid you getting urinary tract infection. Because generally in pregnancy, your immune system is kind of brought down. Yes, your immune system is no longer strong as it used to be. So things can easily affect you easily. And then some people experience pain in their pelvic region, pain at their back, pain in the abdomen. So these pains are signs and symptoms of second trimester. But if you are worried about this pain, you are confused about this pain, you're like, it's so unusual, it's advisable you see your doctor, it's advisable you see your GP, so that things will be done as soon as possible. So don't just assume it's normal in pregnancy, it's normal in pregnancy, it's normal in pregnancy. Sometimes those pains might be as a result of one or two things. And some people experience edema, they start experiencing swelling of their legs, but I did not experience that particularly. So people start experiencing swellings in their legs, they start experiencing pains, they become hypertensive. That can be a sign of pre-eclampsia or eclampsia. So it's advisable during pregnancy, when you notice something that is abnormal, it's advisable you see your midwife, it's advisable you see your GP, it's advisable you see your doctor as soon as possible. Don't take things lightly. As a lady, generally, I advise you, when you notice something different from normal, see your doctor. It is better to see a doctor and they tell you nothing is wrong than to assume nothing is wrong and something is wrong. So whenever you have symptoms that you are not sure of, it's advisable you see your GP. So these are the signs and symptoms of the second trimester you are likely to encounter as a lady that is pregnant. So I think this is all I have to share with you, and I hope it's beneficial for you to know. So just look at your body, what your body wants, and dance to the tune. Yes, when you are not feeling fine, it's advisable you call in sick, because now you are no longer one, you are two, and you have two people to protect, two people to defend, two people to guide. So you're no longer guiding yourself alone. It might not be an easy journey, but trust me, it is worth it when the baby arrived. Thank you very much for staying tuned. Thank you very much for watching this short video. Is it short? No. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all our returning subscribers, this is Nurse Miss Mary saying thank you. Bye and see you in our next video.